What is organ donation for CF lung transplants? Imagine a person with cystic fibrosis whose lungs are so damaged by thick mucus and infections that breathing becomes a struggle. In such cases, a lung transplant can be a life-changing option. Organ donation for cystic fibrosis lung transplants involves receiving healthy lungs from a deceased donor to replace the diseased ones. Since cystic fibrosis causes severe and widespread lung damage, transplanting both lungs is usually necessary. This helps remove the infected tissue and reduces the chance of ongoing infections after surgery. Most donor lungs come from people who have passed away due to brain death or circulatory death. Living lung donation is generally not an option for cystic fibrosis because both lungs are usually affected, and removing one lung wouldn't be enough to improve breathing. The process of matching donor lungs to a recipient involves several important factors. Blood type compatibility is essential to prevent rejection, and the size of the lungs must match the recipient's chest cavity and lung capacity. Sometimes, geographic proximity is considered to reduce transportation time, but matching 4 immune markers or viral status is not typically part of lung matching. Patients waiting for a lung transplant are placed on a waiting list managed by organizations like the United Network for Organ Sharing. The system prioritizes patients based on how urgently they need the transplant, their overall health, and the likelihood of success. The wait can be months or even years, so patients need to stay as healthy as possible during this time. When a suitable donor lung becomes available, the transplant team performs a surgery where the diseased lungs are carefully removed, and the donor lungs are connected to the airway and blood vessels. Because cystic fibrosis affects both lungs, a bilateral or double lung transplant is usually performed to give the best chance for improved breathing and reduced infection risk. After the transplant, patients need lifelong care. They take immunosuppressive medications to prevent rejection of the new lungs and must be vigilant about infections. Regular checkups and lung function tests are crucial to monitor the health of the transplanted lungs. The goal is to improve both survival and quality of life, with many patients living around 9 to 10 years after the procedure. The entire process involves a team of specialists, social support, and careful planning to help patients navigate the challenges and benefits of lung transplantation. In summary, organ donation for cystic fibrosis lung transplants is a complex but vital process that offers hope for those with advanced lung disease. It involves receiving healthy lungs from a deceased donor, matching based on several key factors, and then undergoing surgery followed by lifelong medical care. If you or someone you know is considering this option, it's important to work closely with healthcare professionals to understand all aspects of the transplant journey and ensure the best possible outcome.